Good evening. Welcome to Saturday, July 11th. It's 5:42 p.m. and the news just keeps pouring in. Today we're going to look at... So the mainstream media is finally starting to catch up to the brain damage and the blood clotting and the multi-system organ failure, all this. So the normies are going to be panicking pretty soon as the deaths continue to rise and the situation becomes more and more grim. CDG report number 40. Mainstream media catches up. SARS-2, a multisystem disease. SARS-2 damages not only the lungs, but the kidneys, liver, heart, brain, and nervous system, skin, and gastrointestinal tract. Virtually every major system in the human body. It causes the blood to clot, the heart to lose healthy rhythm, the kidneys to shed blood and protein, and the skin to erupt in rashes and swollen purple COVID toes. It causes headaches, dizziness, muscle aches, stomach pain, and other symptoms, along with classic respiratory symptoms like coughing and fever. These clots can cause lethal strokes, cardiac arrest, or can lodge in the lungs or legs, which can cause amputation, as in Nick Cordero's case. They clog the kidneys and interfere with dialysis treatments. There's a lot of news about clotting, but it's also important to understand that a substantial proportion of these patients suffer kidney, heart, brain damage, and physicians need to treat those conditions along with the respiratory disease. The virus gains entry into the body through ACE2 receptors. Cells lining the blood vessels in the kidneys, the liver ducts, the pancreas, in the intestinal tract, and lining the respiratory tract all are covered with ACE2 receptors. Damage to the pancreas can worsen diabetes. SARS-2 infection can also activates the immune system. This includes the production of inflammatory proteins called cytokines. This inflammation can damage cells and organs, and the so-called cytokine storm is one of the causes of severe symptoms. Blood clotting effects appear to be caused by several different mechanisms: direct damage of the cells lining the blood vessels, and interference with the various clotting mechanisms in the blood itself. Low blood oxygen caused by pneumonia can make the blood more likely to clot. In the immune system, SARS-2 can also deplete the T cells the body usually deploys to fight off viral infections. Doctors need to treat all of these effects when SARS-2 patients show up in the hospital. So this is a virus you don't want to catch, whether you live or die. In fact, those that died might have been left off easy, rather than potentially be left with a lifelong chronic illness, as we've seen many reports. Thank you for being here.